Okay, well, thanks everyone for coming. My name is Rebecca Kiriazes. I'm an assistant professor at the Catholic University of America. The work I'm going to be presenting today is part of my thesis work that I completed at the Georgia Institute of Technology under Dr. Carrie Watkins. So today I'll be talking about impact and analysis of rider comfort in shared modes during the COVID-19 pandemic. So today's webinar is sponsored by the STRIDE Center. STRIDE is the 2016 USDOT Region 4 University Transportation Center. We're a consortium of 10 Southeastern colleges and universities with the University of Florida as the lead institution. Go Gators! STRIDE's mission is to develop novel strategies for reducing congestion. So during today's webinar, we invite you to contribute questions anytime throughout the call during the chat box. And I'll be answering them at the end of the talk. A brief overview of what I'll be talking about today. I'll be quickly defining shared mobility and giving a bit of background for a study. The study has three main components that I'll be talking about today. One is looking at the comparison of online survey recruitment methods. The second part is looking at the wave one of the survey that we sent out, looking at rider comfort in shared modes. And the third part I'll briefly talk about is the shifting perceptions of shared mobility throughout the COVID-19 pandemic, looking at the longitudinal wave 1 and wave 2 panel, and then rounding out with a few conclusions, and then I'll be answering some questions. So shared mobility is defined broadly as mobility that's shared by users in the same space or using the same instruments. So we have public transportation, buses, and trains to get around. Micromobility is also considered part of shared mobility because people are sharing bikes and scooters. There's automobile-based modes for shared mobility, which includes Uber, Lyft. And then finally, there's also commute-based modes for shared mobility. So these are people carpooling to work, so they're going to the same destination. In particular, today, I'm going to focus on public transit, looking at trains and buses, in automobile-based modes, specifically ride-hailing and shared ride-hailing. Sometimes these terms are used interchangeably, ride-hailing and shared ride-hailing. Ride-hailing is when you're calling an Uber just for yourself to get to point A to point B, versus shared ride-hailing is when you are dropping a few people off along the way if you're headed in the same direction. So although they are used interchangeably, they're pretty different things, and one of them may add to congestion, while ideally a shared ride-hailing mode doesn't add as much to congestion. So prior to the pandemic, we saw that a lot of the shared ride-hailing demand was really low. It was too low to produce significant system saving, as well. People were uncomfortable with certain shared mobility sharing scenarios. And then COVID happened, and people became generally uncomfortable sharing spaces with fear of getting germs and being in contact in close proximity with people. So one of the things that I looked at is how COVID impacted shared mobility and our attitudes towards it. So what you're looking at right here is a figure of the positive COVID cases in Metro Atlanta area. So the study that I did took place in Metro Atlanta area, so that's what I'll be focusing on today. In case you don't remember the timeline of COVID, I know it seems like it all washed together at once, but in the spring, we had COVID as a national emergency, and we had an end of the stay-at-home order eventually. So we had pretty low COVID cases because people were just sheltering in place. There was an initial wave that came through of COVID after the sheltering in place ended. Around December time, right before 2020, we had our second wave of COVID. Additionally, we had the first start of a vaccine distribution in December of 2020. This continued all the way, vaccine distribution is still continuing, but as of December 2021, half of Georgia was fully vaccinated. During the summer in Atlanta, social distancing requirements ended. There was an end of statewide emergency, and then there was a second wave, a third wave, the Delta variant of COVID that came across. And then finally today, I'll just be talking to 2022. There was finally the Omicron wave that happened right at the end of 2021. So this timeline is important because it impacts of when we sent out the survey and the attitudes of people during that time period and their relationship with what's going on with COVID. So I sent out a two-wave online survey. So two waves, one in October 20 and one in October 2021. In this survey, it collected a lot of things. One of the things we collected was the reported preferences of level of comfort in ride hailing, shared ride hailing, and public transit during 3 different time periods. So I mentioned the 3 shared mobility forms that we were interested in. During the first wave in October 2020, we asked people about their preferences before, during, and in the future when a vaccine would be available. It's important to note that as of October 2020, when we sent out our survey, people didn't know when a vaccine would be available. They knew it was developing, but they didn't have 100% that it was being distributed at that time. And then the second wave survey we sent out was October 2021, which asked people their reported preferences in the summer, currently, so October 2021, and then post-COVID, a year from our second wave survey. In addition to our reported preferences, we also asked people their revealed preferences, so their actual modal usage frequency. We asked their modal usage frequency before COVID, October 2020, in the summer, in October 2021. So we asked them, how much did you actually use? And then finally, in the survey, the two-way survey, we asked a number of different attitudinal questions towards their modal and environmental factors, as well as information about their socio-demographic information. So our survey wasn't super duper long. It took people probably like less than 10 minutes to complete, and it was all done online. We went through 5 main contact methods to reach out to the people taking the survey, and I'm going to briefly go over all of them. So one of the ways that we reached out to people to take our survey in the Atlanta area was through email Recontact. So this involved reaching out over email to all of the people that said that they would be interested in filling out future surveys at Georgia Tech, who, if they had filled out prior transportation surveys, we recontacted them again. So we recontacted almost 1,500 participants, and we ended up with 211 quality wave 1 responses from this first method. So you'll note here we had a variety of people that didn't fully complete the survey, as well as we had some people that had a different zip code. So initially, maybe they were a part of this, maybe they lived in Atlanta when they were filling out the Georgia Tech survey of a couple years ago, and then they had a different zip code, so they moved. So we screened all those individuals out. Another method that we used to recruit participants for our survey was through community outreach. So I reached out to 58 neighborhood organizations, and they agreed to share, some of them agreed to share our survey online or on the newsletters, and this resulted in 132 quality responses. I also implemented a Facebook ad where we put a Facebook ad that says, please participate if you are looking in the Atlanta area and were willing to fill out a survey. So there was no incentive for people participating in our survey, and this ended up with 46 quality respondents. And then our largest recruitment method for our Wave 1 survey involved our paid online opinion panel service. So this was through Qualtrics. So everything was handled on their end. We just sent them our survey. They initially had 1,000 people try to take our survey. They filtered out some participants that didn't live or work outside of Atlanta, and that's per our request. And then additionally, some people were filtered out due to an attention check. So you'll note that this is 339 of the 861 people that qualified for their survey were screened out due to the attention check. So they indicated that they had used Uber Pool during COVID, which wasn't possible during the time. Uber Pool shut down right at the start of the pandemic, and Lyft line as well. So those services weren't available. They only recently became available over the summer in certain cities. So with the Qualtrics online paid opinion panel service, we ended up with 384 responses. We also filtered out 67 people from this method that had incoherent text responses. We had a couple places where you could answer extra questions if you wanted to, and they wrote gobbledygook. So this was concerning for us. We thought it was a red flag. We flagged them and screened them out of our survey. So this was a fairly large amount of people that we had to screen out individually. And then we also recruited through Mechanical Turk, which is an opt-in panel service through Amazon, and this only resulted in 14 quality respondents. We think this low number is due to we required the people who participated in this to fill out a survey before they got to see our survey to filter out the people that lived and worked in Atlanta. So we think that might be a reason why there's a low number of participants there. So all in all, it resulted in 787 responses for our Wave survey, our Wave 1 survey. So I'll talk a little bit about our data from the Wave 1 survey, and then I'll talk about the Wave 1 and Wave 2 survey. So what you're looking right here is the difference in percentage points of the population and respondent attributes. So here are our socio-demographics for our Wave 1 survey. What you'll note here is that the local newsletters, the local email newsletters, so this was our community outreach and our Facebook advertisements, overly recruited the female population, as well as all of our survey methods over-recruited the white population compared to the general Atlanta population. They also over-recruited people who have higher education, so they have a bachelor's degree or higher. Additionally, some of our recruitment methods sampled different age demographics. So our Qualtrics panel and our Mechanical Turk overly sampled a younger population. Our pre-recruited panel and our community outreach oversampled people 35 plus, while our Facebook advertisements oversampled people 50 plus. And then finally, we saw that our pre-recruited panel, our community outreach, and our Mechanical Turk oversampled the wealthier, higher income populations as well. So we know that our Wave 1 sample didn't match the Atlanta, fully represent the Atlanta population, but we're just having that as a caveat for some of our data going forward. What you're looking at here is we asked all of our participants in the Wave 1 survey how often they use the different shared modes. You'll see that only 20% of our active ride-hailing users are also shared active ride-hailing users. So this is in our Wave 1 survey. Prior to the pandemic, people didn't use shared ride-hailing actively too often. You'll also see that the Qualtrics paid panel, all of them, there's more shared mobility users that are active users in our Qualtrics panel compared to the other recruitment methods. We also had a multimodal lifestyle indicator. So this was for respondents who indicated that they use a form that's not a private vehicle daily. So if they indicated that they walked or took transit or took ride hailing, they were considered multimodal at least once a week. So we found that the largest percentage of multimodal lifestyle indicators occurred during the Qualtrics online paid panel and the pre-recruited panel. What you're looking at right here is part of the first paper that this STRIDE report involves. It talks briefly about all of the online recruitment methods that we went about and went through some of the things we ran into, some of the struggles we ran into. So this is a summary of the online recruitment methods. What you'll see at the bottom here is what I talked about prior about the differences in demographic representation and shared mobility usage among the different recruitment methods. It's also important to note that they cost different amounts. So our Facebook ad ended up costing $10 per quality respondent, while our Mechanical Turk only cost $3 per quality respondent. And our community outreach and our email recontact were free. It just took our personal effort. So it's important to look at all, when you're picking your survey recruitment method, it's important to understand what your budget is, your timeline, what your population is that you're looking for, to make sure you're able to recruit the optimal amount of participants that you're looking for. We also found a couple red flags when we were looking for our quality completion rate. So you'll see here that our Qualtrics online paid panel has the lowest quality completion rate. And this was due to a number of quality concerns that we saw. We saw lots of incoherent and inappropriate text responses, as well as attention checks where we had over 300 participants say that they had used Uber Pool during the pandemic, which wasn't possible at that time. So that was a bit about our survey method. So we'll briefly go into our results. So what you're seeing here, we asked our participants before COVID-19, would you feel comfortable using the different shared modes? And they ranked from strongly disagree to strongly agree. So you'll see before COVID, we had the majority of people agree that they felt comfortable using ride hailing and public transit, but they did not agree that they felt comfortable using shared ride hailing. So this is before the pandemic even came into play. During COVID, we found that the majority of people they strongly disagreed that they felt comfortable using shared ride hailing during the pandemic, as well as you'll see that more people felt uncomfortable using ride hailing and public transit during the pandemic. And then finally, in the future, we asked how comfortable do you think you'll feel using all these different shared modes? And we found that although there were similar levels of comfort from before to future, they were slightly lower than the before. So people aren't fully returning to their prior levels of comfort. What you'll see here is a few histograms of the change in comfort of shared mobility. So -4 represents people who changed from strongly disagree or strongly agree to strongly disagree, while the 0 is for people who didn't change their ranking from and on the Likert scale at all. So what you'll see here is that among all of the shared modes, before to during, people decreased. From during to after the pandemic, people generally increased their comfort using shared mobility. And then across all modes, if we're looking for the before to after, we found that the majority of people either didn't change their level of comfort or slightly decreased it. So we wanted to dive a little bit deeper into what that meant during the different periods of the pandemic. So we went through and did a factor analysis of our number of attitudinal statements, and we narrowed our attitudinal statements down into 4 factors that we used in our model going forward. So I'm just going to briefly talk about the factors that we found. We found our 4 variables positively related to wearing masks and improving circulation in shared modes. So this is our follow a safety measure factor. We also found a factor where 4 variables related positively to interacting with other people. So this extrovert factor was for people who enjoyed chatting with the ride-hailing driver, so they're more comfortable around people generally. We also found a trust precautions factor. So these are 4 variables related to the comfort and trust of shared mobility and precautions during the pandemic. So you'll see here that these people trust the extra precautions taken by MARTA. If people are wearing a mask, they're more comfortable. And then finally, the last factor that we found was our germaphobe factor. So these are people who are generally germaphobes. They always carry hand sanitizer regardless, and their family considers them germ conscious. So using our factors, our socio-demographic attitudes, we wanted to predict the comfort of shared modes during the different stages of the pandemic for wave 1. And the method we went about is an ordered logit model with marginal effects. So we used a logit model because we had explanatory variables and a dependent variable. It was ordered because we had an ordered nature of our dependent variables. So we had strongly disagree to strongly agree that they felt comfortable using shared modes. And then the marginal effects are the impact of 1 unit change in an independent variable on outcomes probability. So I won't be talking about the marginal effects, but in the full report, it dives deeper and shows all the marginal effects of predicting comfort using shared mobility during the different modes. One of the models I'm presenting to you guys today is our wave 1 during COVID-19 model. So this is in October 2020. What you'll see here is we don't have any socio-demographic variables significant in our model. So we found that these attitudes in our prior usage indicator were good at predicting where people felt comfortable using shared mobility during the pandemic, and none of the socio-demographic information we found was significant enough to include in our model. Additionally, you'll see that our prior usage indicator is significant, and it's negative across all of our different shared modes. So our non-users were more likely to strongly disagree that they felt comfortable using transit, ride-hailing, and shared ride-hailing more than our occasional and active users. So these are people who had never used these modes before. They were more likely to strongly disagree that they felt using shared modes during COVID was comfortable. Another interesting model that I'll present right now is looking at our wave 1 post-pandemic. So this is when we ask people, how comfortable would you be in the future when a vaccine will be available? So one of the things I found interesting here, so we had our attitudinal factors like our during COVID model, but we also had socio-demographic indicators that became significant in our new model. We found that in shared ride hailing and public transit, Our male indicator variable indicated that people may be more likely to feel comfortable using shared mobility in the future, as well as our occasional and our active users were more likely to feel comfortable using shared mobility in the post-pandemic scenario. That was a little bit about our Wave 1 survey. I'm going to briefly talk about, this is just a reminder of our Wave 1 versus our Wave 2. So our Wave 2 came out in October 2020. It came out in between the Delta and Omicron variants. So at the time when people were relatively not too concerned at COVID because there wasn't a big variant going on. So our Wave 1 resulted in 787 responses. Our Wave 2, we reached out to our email recontact, our community outreach, and our Facebook ads respondents. So of those 787, we reached out to some of those respondents. We weren't able to reach out to our Qualtrics respondents who responded to Wave 1 because it was through their Qualtrics system, so we didn't have their personal emails to reach out to them, as well as the Mechanical Turk. We weren't able to ask for that private information. Our Wave 2 survey ended up resulting in 162 responses. So 162 respondents that completed survey our Wave 1 and our Wave 2. Looking at our demographics of our Wave 2 survey, it's important to note that we still had a higher income panel, as well as they were more female, they were less diverse, they were highly educated, just like our Wave 1 panel, because it makes up of it. Additionally, we had more shared ride-hailing non-users than panel 1, so we had more people that had never used shared ride-hailing complete our Wave 2. As well, we had more transit and ride-hailing occasional users than our panel 1. In addition to socio-demographic information and questions that we asked on our Wave 1 survey, in our Wave 2 survey, it came out after the vaccine was available. So we asked a number of questions related to vaccines and how that may impact their attitude to in shared rides during COVID. The majority, almost all of our panel was vaccinated, 98%, which is higher than the level of vaccination status in the state of Georgia at the time. So it doesn't represent the Atlanta population in terms of vaccination. What you see right here is the change in usage. So we asked people what the frequency of their actual usage of personal vehicles, teleworking, private ride hailing, and transit, a number of other modes as well. But these ones I thought were important to note. So you'll see that before the pandemic, we had an overall decrease in personal vehicle, private ride hailing, and transit usage, as well as an increase in telework from pre-COVID to fall 2020. The time after fall 2020, there was an increase in personal vehicle usage, in private ride hailing, and transit. So people were starting to return back. And then from summer 2021 to fall 2021, we saw only minimal changes in usage of frequency of usage among our modes. And that kind of aligns with a lot of the different regulations and rules regarding COVID, masking, staying in, sheltering in place, going up. So we saw that this is our new normal period right here. Additionally, right here, what you'll see here is the pre-COVID to fall 2021 and our fall 21 or our fall 20 to fall 2021 change in usage. So you'll see that personal vehicle overall usage decreased, and our teleworking overall increased, as well as our private ride hailing and our transit actual usage also decreased. So what you're seeing right here is the change in attitudes. We asked a number of attitudinal questions during our two-wave survey. So it has the average during fall 2020 and fall 2021. And then I also mapped it over our Wave 1 factors. So you'll see that the factors that were related to are following our safety measure factor that we found overall decreased. So people prior to fall 2021, they said that a mask should be required for all passengers on transit, and they seem to have loosened up on their views there. And in addition to the other, so that was just general attitudes related to COVID and a variety of other things. So we asked again how comfortable they would be riding the different shared modes during the different time periods. So what you'll see here, so this is the average change in attitude towards shared mobility. So from pre-COVID to October 2020, we saw an overall negative change. From October 20 to summer 2021, we saw an increase. In summer 2021 to October 2021, we saw no change or a negative change during the Delta variant. And then October 2021 to October 2022, we saw a small but increase in change in attitudes towards shared mobility. So I'm going to break it out a little bit more. So what you're seeing right here is an alluvial diagram showing the flow of showing the flow between the different time periods of people's attitudes towards transit. So right here, you'll see that this is how people responded to the I feel comfortable using transit question before COVID and during the different time periods. So if a respondent strongly disagreed in the first column, you'll see that their color moves across the flow diagram. It's interesting to note right here that for transit, before COVID, again, people felt generally comfortable using it. During COVID in October 2020, people felt uncomfortable using it. When a vaccine is available, they thought that they would feel more comfortable using it. When it actually came around to summer 2021, what they thought didn't end up actually becoming true. So this is the transit alluvial diagram. I'm going to show you guys the ride-hailing alluvial diagram. So I'm going to flip in between them real quick. They are fairly similar. So we're seeing similar trends of people before feeling generally comfortable, but not returning to their prior levels of comfort. So what you'll see here is that before COVID, people felt generally comfortable, and they were predicting in the future that they will feel comfortable, but not quite as comfortable as they did prior to the pandemic. The alluvial diagram that looks a little bit different is our comfort using shared ride-hailing during the pandemic. So you'll see a lot more red. So a lot more people strongly disagree that they feel comfortable using this mode during the different phases of the pandemic. And then one of the things that I'll pull out real quick and talk about to finish up is just looking at the difference in what our respondents answered. In our Wave 1 survey, we asked, in the future when a vaccine was available, what do you predict your level of comfort will be? Versus our actually in summer 2021 during our second wave survey when a vaccine was available, we asked them how comfortable would they be using transit, and it didn't match up. So to pull out that a little bit further, what you'll see here is that the level of comfort should be the same in the ideal world, or pretty close to it, for our Wave 1 in the future when a vaccine's available, and versus our summer 2021 when a vaccine actually was available. But we only had around a third of our respondents correctly predict their future level of comfort, matching their actual level of comfort. It's interesting to note that the largest, that 70% of our respondents incorrectly predicted their shared ride-hailing level of comfort, a similar level with transit, versus for ride-hail, we had 59% of our respondents incorrectly predict their future level of comfort. I think it's interesting too to see that we had more of our respondents be too positive about the future, so they thought that they might return back to a different level of comfort, versus we saw a lot fewer of our respondents say that they were going to be too negative, which meant that in the future they said, oh, I'm never going to return back, but it ended up being like, oh, they did return back a bit. Diving a little bit more into the demographic information related to this ability to predict the future, we saw that our Gen X 41 through 55 were more likely to correctly predict their future attitudes related to ride hailing. And then while our transit choice riders, so these were people who used transit but were higher income, they were not accurate when predicting their future level of comfort using transit. So these respondents said that they were thinking about returning to transit, and then in the future they would feel more comfortable using it, but in actuality that's not what happened. So that quickly was a bit about, the last little bit was about our shifting perceptions during the different waves of the pandemic. So this slide is just a brief conclusion on our comparison of online survey recruitment methods, which I talked about in the beginning. But it's important to note that no platform recruited evenly across our demographic and middle frequencies, because there's a variety of trade-offs regarding to recruitment effort, time, and money that impacts the amount and quality of our responses. We also saw that our Qualtrics paid panel contained a number of data quality red flags. That was the main conclusion from our comparison of recruitment methods. When we were looking at the Wave 1 survey, we found that the usage of shared modes didn't return to pre-pandemic levels as of October 2020, and that the level of comfort using shared modes has declined. It is not predicted to return to pre-pandemic levels, even when a vaccine was available. And then when we were looking at our Wave 1 and our Wave 2, the last column here, you'll see that the level of comfort will not return to pre-pandemic levels, especially for our shared ride hailing. People were still uncomfortable using it, as well as respondents were poor at predicting their future attitudes during this time of uncertainty. So during all the phases of the pandemic and all the waves about, people thought that they might return quicker than they actually felt comfortable doing. So that's a bit about my presentation now. I'll be looking in the chat box and answering any questions in the Q&A. And I want to thank you guys for attending. Also in the chat, Odine's she put out all of the other fall Stride webinars that are going to be coming up. There's a lot coming up this fall that I encourage you guys to attend. And then there's a survey as well for Stride to plan their future webinars, if you could complete that as well. So again, if there's any questions, you can put them in the chat or in the Q&A and I'll read them out. Thank you. We have a question in the chat. Where is it? Sorry. It says, if you did an October 2022 survey, how do you think it would compare? So again, I haven't done an October 2022 survey. It is October 22 now, so should I send another one out? But if I had to predict what I would see, so shared ride hailing only became available in certain cities fairly recently over the summer. And a lot of times it's not even an option when I've gone on and checked. So I expect that people would not feel comfortable using shared ride hailing, even currently in October 2022, because one, it's not available in a lot of places, so they may not even think of it as an option. As far as transit and ride hailing, I suspect that people are comfortable using ride hailing again. I think we would see those similar to pre-pandemic levels of comfort using private ride hailing. And I would suspect that for transit, it would be similar but lower to our before COVID levels. So I expect the trends to overall increase in comfort for transit and ride hailing in this 2022 compared to our 2021. But I don't expect them to be too different as of October 2021, at least in Atlanta, Georgia, people had returned mostly to their new normal situations. There's another question here that says, awesome presentation, thought that a lot of complex data was broken down in a very intuitive manner. Are you aware of any similar studies from different regions of the US or internationally, and how Atlanta's results compared to those? So there are a couple of big studies that, well, a lot of stuff happened with COVID that people are researching right now. The biggest ones that I'm aware of is there was a big effort in Arizona by the University of Arizona that was a consortium of other universities put in by as well. They also, I think, took some data internationally looking at the different regions. And I think there's one also in California, looking at the California region. So the California one was part of a bigger survey. So it didn't specifically focus on COVID, but the Arizona one did specifically focus on COVID. So I expect that the Atlanta results would show that people return to a level of comfort or a new normal, whatever that would entail, quicker than the California study, which was just looking at California due to their COVID regulations at the time. So California was a lot slower to reopen than Georgia. So I expect that maybe they were like a year or half a year out looking at our trends. So the Atlanta trends might be kind of quicker and showing what the California trends might show in the future. And yeah, let me know if there's more follow-up. Oh, I forgot to click on, sorry. And then another question is, answer live. Did the work at home cohort not returning to the office impact the attitude differential for shared mobility? So this is something that I still haven't dived deep into. So we did have a large change in teleworking. So like I said, of our panel, we saw a lot more people teleworking more frequently. So these people were working at home and not returning to the office. It may have impacted their attitude differential for shared mobility. So those people who, the people who were working at home didn't see what it was like to use transit or ride hailing or shared ride hailing. Like if they went on transit, they would see, hey, it's not quite as packed as I thought. So maybe I do actually feel more comfortable than what I'm saying. So I think in that sense, it would have impacted the attitude differential for shared mobility. But it's not something I was able to boil down specifically and find. For generally ride hailing though, ride hailing is used for some commuters, so some people going to and from the office, but it's often frequently used for more recreational use. So in that sense, we wouldn't really see a shift in attitudes for ride hailing because it's used more recreationally than transit and shared ride hailing. So thanks for your questions. If you guys have more follow-ups, feel free to put them in the chat, or you can reach out to me through my email, and we can continue the discussion later as well. I would love to talk more about it and dig more into the data.
Thank you so much, Becca. This was a great webinar. We will be sending everybody who registered a link to the recording, and in that will also be a link to the project website and we can provide your email for follow-ups as well.
Perfect, thank you.
Thank you, everybody, and we hope to see you on a future STRIDE webinar.